In this video, we're going to cover the topic of cancer, and our learning objective is to be able to describe cancer as a result of changes that lead to uncontrolled cell growth and division. As always, all of the timestamps will be in the description below, so feel free to skip to whatever part you need help with. These are our two key definitions for this video. The first one is a benign tumour, which is a growth of abnormal cells contained in one area, usually within a membrane. Secondly, we've got a malignant tumour, which are cancers that invade neighbouring tissues and spread to different parts of the body. While there's no required knowledge for this topic relates really well to mitosis and the cell cycle, as the origin of cancer itself is uncontrolled growth and division, and this occurs when the cell cycle is not regulated properly. Put in very simple terms, cancer is what results from uncontrolled growth and division of cells. So for example, on the left-hand side, we just have one cell by itself. However, if the cell becomes cancerous due to changes in its DNA, it can undergo uncontrolled growth and division through mitosis and the cell cycle and produce lots more cells, which are then going to divide further. And this group of cells is known as a tumour, which may or may not be cancerous. The two main types of cancer tumour are benign and malignant. So benign tumours generally grow in one place, usually within a capsule or a membrane, and these are not cancerous, i.e. benign. They generally grow until there is no more room within their space, and they do not invade other tissues. However, they can press or damage other organs, which can then be dangerous. On the other hand, malignant tumours are cancerous and invasive, so they can split up and spread through the bloodstream or lymphatic system and move to other places in the body and cause secondary tumours. These cancer cells also divide more rapidly and have a longer lifespan in comparison with benign or normal cells. While cancer can occur for no reason, there are various risk factors which do increase a person's risk of developing cancer. So quite a common one is smoking, and that can lead to an increased risk of lung, mouth, bowel, stomach and cervical cancer. Also, there's obesity, which can lead to an increased risk of bowel, liver and kidney cancer. In terms of radiation, if you get a lot of UV ray or light exposure from the sun, that can lead to an increased risk of skin cancer. And also X-rays of certain parts of the body can increase the risk of developing cancer there. In terms of infections, certain viruses or diseases can lead to an increased risk of cancer. So for example, infection with HPV can lead to an increased risk of cervical cancer, and infection with Hep B and C can lead to an increased risk of liver cancer. There's also various genetic components which lead to cancer, and there's so many mutations which can lead to an increased risk. However, quite a common one is mutations which lead to breast and ovarian cancer. This is our first worked example question for this topic. So bronchi are airways leading to the lungs. Smoking cigarettes damages cells lining the bronchi. What is the name of these cells? Choose your answer from the list. So our options are ciliated epithelial cells, gamete cells, red blood cells and white blood cells. So even if you don't know the answer to this question beforehand, you can pretty much deduce it from the available options. So it's talking about cells which are in the lungs and also lining the bronchi. So we can immediately eliminate red blood cells and white blood cells, as obviously they're found in the blood. Then the other two options, we've got gamete cells and epithelial cells. And as it says in the question that these cells are going to be lining the bronchi, we know that epithelial cells are normally a lining cell. So we're going to go for the first option, which is ciliated epithelial cells. So smoking can cause cancer in cells lining the bronchi. Describe and explain one other way the smoke affects cells lining the bronchi. So if we look at our answer to the first part of the question, it says that these cells are ciliated, which means they possess cilia, So we can deduce that smoking, or the smoke from smoking, is going to affect these cilia. So smoking damages cilia, and these cilia are responsible for moving mucus, which contains pathogens and dust and other kind of irritants. So they can't remove pathogens / dust. For the second part of the question, there are two main types of tumour. People who smoke are more likely to get malignant tumours. Name the other type of tumour and describe how it differs from a malignant tumour. So thinking back to earlier in the video, the other main type of tumour is going to be benign. And there's a few ways in which they differ. You could put down that they grow in one place, so i.e. they are non-invasive. And they are also non-cancerous and usually stop growing. Thank you for watching this video. By now you should be able to explain how cancer occurs and the main differences between benign and malignant tumours, as well as various risk factors which may increase the risk of developing certain cancers. Now it's time to do some relevant exam questions.